Cyber attacks have caused costly breaches of personal data and disruption of critical systems like oil pipelines and mass transit, but they are also increasingly a matter of life and death. So in tonight's Prime Focus, we examine why America's hospitals are becoming a top target for hackers and how they're already having a dramatic impact on our health care. Tonight, our Devin Dwyer has some new research and what can be done about these attacks.
Squeeze my hand, sir, best you can.
Let's get him on the vent.
Let's call ICU. I'm just trying to think.
In the emergency room, minutes and seconds can decide life or death.
Starting chest compressions.
Simulations like this one train doctors to respond quickly to the unexpected.
Charging. Shocking.
We were invited to watch Dr. Arman Hussein, a second-year resident, practice his skills when suddenly
there's something happening with our IT systems right now.
A mock cyber attack locks down his computer as he's treating patients in crisis.
Our monitor is down.
Dr. Hussein is calm under pressure, but instantly without critical tools.
I don't even know where the paper charts are.
Like electronic patient records, test results, and contact with other departments and hospitals.
How disruptive was it to lose all the technology that's connected to the network?
Pretty disruptive, just because you need to have information fast, and not having information is probably the most panic-inducing thing. It's like I can't make a decision if I don't have information.
It happened in real life 3 years ago, just as the pandemic was taking hold. Cyber criminals targeted the University of Vermont Hospital Network.
It was terrible.
Dr. Stephen Leffler, the hospital's president, was seeing patients in Burlington that day.
My email stopped working, which is odd, but not, it does happen once in a while.
Was a cyber attack even in your consciousness?
No. I didn't even think that was a possibility. It was challenging because our phones weren't working. We actually sent some staff to Best Buy to buy walkie-talkies, and we started switching over to our paper systems. I got a call from our IT leader. He said, every server that we have has been infected.
Those servers were immediately taken offline. Leffler says no patient information was leaked, but that the impact on patient care was substantial.
There were people that were scheduled for staging cancer operations, and we had to make a decision, should we do it? And we did them when it was appropriate. Some we were able to delay.
The crisis stretched for 28 days. 1,300 hospital servers and 5,000 computers had to be wiped, a job so big the governor called in the National Guard. All told, it cost the hospital more than $50 million, an expense some experts say inevitably drives up the cost of care.
We've had 3 years of COVID. This was much harder by a factor of 10.
Harder than COVID?
Much harder for us.
Very, very lucky.
Jess Krause and his wife Kara were UVM patients at the time and lived through it.
I had been diagnosed in early September with stage 3 colorectal cancer. You really don't know if you're going to live or die at that point.
Just as his doctors began an aggressive radiation and chemo plan, Krause was told it all had to be put on hold indefinitely.
I got a call that day saying, yeah, don't come, you know, we're figuring it out.
We were like, what? Like, this is really critical life or death treatment, radiation. And it was very timely because Jess's tumor was quite large.
How many appointments did you have to miss? Do you remember?
Probably about a week.
We were afraid. We weren't sure if that would affect the outcome. Again, the tumor, would it start growing back within that week?
We ready? Come on, bud.
Today, Krause's cancer is in remission, and he's sounding the alarm about the impact of cyber attacks on patients.
In the grand scheme of things, you know, it's easy to look at it now and say, okay, yeah, you know, it was a week delay and it didn't really impact it. I hope that it's been a lesson learned to hospitals. You need to have systems in place to be able to immediately pivot if you need to.
Research shows cyber attacks on hospitals, once thought to be most damaging to patient privacy, are potentially endangering American lives.
A cyber attack on a hospital is not an economic crime. It is not a victimless crime. These are direct threats to patient safety and threats to life crimes.
The number of cyber attacks on U.S. hospitals each year has doubled since 2016, from 43 incidents to 91 in 2021. Experts say healthcare networks are ripe targets because they're most vulnerable and because hospitals are most likely to pay a ransom.
And our IT experts knew as soon as they looked at what happened, that a ransom would not have restored our system. And so we did not pay the ransom. We did not contact the people who did it.
A new government analysis finds nearly all hospitals are operating with critical systems or software with known vulnerabilities, but only half, according to the report, have a plan to address them.
What's the biggest lesson you think other hospitals in America need to take from what happened at UVM?
It can happen to you. Even when you think it's impossible, it can happen, and it affects everything you do in the ways you provide care for your patients.
U.S. public health officials say cyber attacks are the single largest threat to America's hospitals, deserving immediate attention. The average incident disrupting patient care for 19 days and stretching far beyond an individual hospital.
Our studies showed the secondary effects, these blast radius ecosystem effects, and saw increased emergency department patients. They saw way more patients than they normally do. If you're in the waiting room, you waited longer at hospitals next to ransomware attacks because there were so many more patients. So way more ambulances. One's a trauma center, one's a stroke center. When those types of specialty centers go down, those patients go to the periphery.
So a cyber attack on one hospital has a much broader effect.
Huge effect in the entire region.
I was just like, all right, I'm not going to use that. We'll just go to manual everything.
Dr. Hussein says more practice without computers is urgently needed.
Strong work, guys. Done. Way go, team.
But experts say hospital administrators also need to beef up their defenses. Josh Corman, a top U.S. cybersecurity expert who helped design the simulation we saw, says a mindset shift is needed and fast.
We're just not trained for this. We're not prepared for this. We implicitly trust and depend on these technologies. And when they're not available, bad things can happen.
If you can greatly reduce or eliminate the impact by having multiple systems in place, then that seems like it would be an important step forward.
I feel like we're some of the lucky ones, you know, that we had an amazing doctor who went above and beyond. But I think system improvements to communication need to happen, but especially now.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.